All right, hello class. We are going to film the lab for electrocardiography. So our plan will be to first place the 10 electrodes on Evan, who is our subject, and we will then hook him up to the 12-lead EKG. We'll have him lay down supine on the table first. We'll collect some resting data, which you all can record in your lab assignment. Then we will transition him to the treadmill, which is over there, and we'll have him do a few stages of the Bruce treadmill protocol, so you can see what a stress test would look like, and we'll interpret his heart rate and his rhythm as the test goes on. Okay, so we're going to start with placement. Morgan is going to place the electrodes on Evan. A couple quick things before we start. It is important for comfort more to make sure that there's not going to be a lot of body hair that's going to be where we want to put the electrodes, more for the sake of taking them off, because if you take them off over hair, it's going to rip it out. You can use, obviously, you may have to do this on a female or a male. For a female, what I would do is I would have the female probably just wear a sports bra, and we might have to manipulate where we put the electrodes slightly based upon female anatomy. In this case, with Evan, we would just have him take his shirt off, and that's what I would do with the basic male. Okay, so what we're going to do is go through the placement of the 10 electrodes. Morgan is going to clean the spot first, and then we'll place it. So we're going to start with the limb leads, which are left arm, left leg, right leg. We're always going to start on the right side, doing the right arm first. So that location is at the mid-clavicular line. So we're going to find the proximal and distal points of the clavicle. We're going to find that midpoint. We're then going to go into the space right below the bone. We always want to make sure we place the center of the electrode on bone, or on soft tissue, not on bone. So once we have the site cleaned, he's going to dry it and actually rough it up a little bit with the gauze. The purpose of that is to remove as much oil as possible. That should enhance adhesion and conduction of the electrode. Once we get it cleaned and dried, then we are going to place the electrode with the center of it over soft tissue. Now while Morgan goes ahead and does the left arm, I'm going to just talk about the electrodes briefly. You see these pretty good? So these are pretty large. Once we get down into the leads that go on the rib cage, the electrode, the foam cutout is going to be on bone. The key is we want to have the center, so this little snap has to be over soft tissue. So that'll become more important as we go lower. Up here under the mid-clavicular line for left arm, right arm, it's usually not an issue. But once we get around the rib cage, we'll have to kind of focus on that. So we have our upper limb leads placed. Now we're going to go with the lower limb leads, so right leg, left leg. Right leg is going to be placed first. That's the ground. So what we're going to do for this one is stay in the mid-clavicular line. We're going to find the last intercostal space. So we're going to find the last rib that's attached, not the floating rib, but the last rib that is attached to the sternum. Once we find that, we're going to go above that rib. So we're going to just locate that last rib, and then he's going to roll his finger up into that intercostal space, so the space between the ribs. Again, this is going to be a much smaller space. The width of the space is going to vary greatly based upon the person's anatomy. So if somebody has a large rib cage, the spaces will be larger. Smaller rib cages, the spaces will be smaller. Once we locate it, clean it, dry it, now we'll place the electrode with that center snap over the soft tissue. So that is our right leg. Now we'll go over to the left side, so left leg. So these will be our last limb lead. Now, if we were doing a single lead EKG, we could just use these four. They are called the limb leads. Notice that we're placing them on the torso. The reason for that is if they were on the limbs and we had him start exercising, there would be a lot of interference that would reduce the quality of our recording. So by placing him on the torso, we'll have more stability with exercise. If he was just going to be laying supine, we could put them on the limbs and it would not be a big deal. But since we plan to have him exercising, we place them on the torso. All right, so we have our four. Basically, we created a nice box. Again, we could collect a single lead EKG recording from this, but we're going to actually now move into the chest leads, place 6 more electrodes, and by doing that, we'll be able to get our 12 lead EKG. So there is 1 that's going to go on the right side, 5 that are going to go on the left. I'll give you a second to think about why that might be. Of course, it's because the heart is on the left side of the body, so we're going to sort of really basically wrap around the torso, sort of mimicking the way that the heart lays in the chest cavity. So we're going to start with the V1, which is going to be on the right side. So for this one, we're going to have to find the 4th intercostal space. So we're going to find the clavicle, go down into the subclavicular space and find the first rib. So then Morgan is going to just basically walk his fingers down. Second rib, second space, third rib, third space. He's then going to find that fourth rib, go right below that, find the fourth space. We then need to be on the sternal border, so we're going to get as close to the sternum as we can, but staying over soft tissue. There could be quite a bit of muscle tissue there that you have to really sort of dig through to find the space. So you shouldn't be afraid to really sort of prod and poke somebody when you're trying to find these spaces. As you might imagine, with a female anatomy, this could present some more challenges, but typically you can find that sternal border pretty easily without having to put your hands too much on breast tissue. So once we have V1 placed, now we're going to go to V2. So V2 is going to be on the left side, again in the fourth intercostal space along the sternal border. Don't assume it's going to be directly across. Nobody is 100% symmetrical, so he should still do the count as he is doing now. And what we might notice once he places it is these are not going to be perfectly parallel with one another. There might be elevated or depressed slightly, again, just because nobody is 100% symmetrical. So he's cleaned it, dried it, scuffed it up, removed all the oil from the skin as possible. And then he's going to place V2. So V3 would fall next numerically, but V3 is going to be placed halfway between V2 and V4, which tells us we need to place V4 first. We're going to skip V3 for now, go to V4. For V4, we're going to be back in the mid-clavicular line, but now we're going to be in the fifth intercostal space. We're going to drop down one space and move back into that line that we established with the left arm and the left leg electrode. This is one that you might have to vary the placement on because sometimes potentially that spot could be right under an individual's nipple. You don't ever want to place an electrode directly on a nipple, so you might have to vary the placement slightly based upon the person's anatomy. Again, just make sure that the center of that electrode is over soft tissue and not right on top of a rib. For females, typically this will be something you might have to kind of elevate the breast slightly or ask the subject to elevate their breast slightly and place the electrode underneath. Okay, so now we have V4. We left enough space here that we can place V3 without the electrodes touching. That's another key thing. It's going to get kind of crowded as we get into the chest electrodes. We want to make sure there is space that we can place the ones in between without them touching. So now that we have V4 placed, we're going to go back and place V3. Not exactly midway between V2 and V4, because if we went midway between them, it would be on a rib. So we're probably going to have to drop V3 down slightly to be a little bit more in line with V4 rather than being directly in between V2 and V4. So notice it is dropped down just slightly. There is a slight amount of space between the electrodes, so we are still in good shape from that perspective. All right, two more. So next, V5 is supposed to go halfway between V4 and V6, which means we're going to have to place V6 next. Go back to V5, so V6 is going to be in the fifth intercostal space, so in the line that we've established here. But now it's going to be in the mid-axillary line of the subject. So often we'll just have the subject elevate their arm. The rib cage does sort of wrap, move superiorly as it wraps around the body. So again, your line is not going to be perfectly parallel as we move around the body. Often V6 is going to be a little bit higher than these two, even though it is still in the same intercostal space, again, because of the way the ribs often will wrap up and around on individuals. Once V6 is placed, the subject can relax, and we'll go back now and place our last lead. This is V5, so midway between V4 and V6. Should be plenty of space here, so you don't have to worry about the electrodes coming into contact, and the intercostal space is usually fairly easy to locate within this location as well. All right, so we have all 10 electrodes placed. We are ready to do a 12-lead EKG. We're going to take a quick pause, reposition, and we'll hook the wires up to Evan, and we'll start getting some resting data collected on him. So we'll be right back.